Alrighty, it's Stacy with Spectrum, the other clinic. I'm going to be demonstrating an intramuscular injection today, but first just a couple of little notes here. This is not an alcohol wipe, it is standing in for one. I just needed big stuff so y'all could see it. Also, the needle that is going to be on this syringe is an 18 gauge. It is quite thick and large. Just so you know, this is not a needle that you would be using to give yourself an injection with, but I did need a large needle so that y'all could actually see it on the screen. This is my fake little piece of skin. This is a friend's vial of testosterone, and I'm not going to ruin it. So I'm not going to actually draw medication out of it. I'm just going to draw air, just so you know. And this technique goes for either testosterone or estrogen, doesn't matter which. Both of them are quite thick and difficult to draw out and to push out of a needle. So just know that they're both oil-based and quite thick. So the speed at which I do this injection stuff is probably a lot faster than what you will experience in real life. Anyway, without further ado, I'm going to stand up and you're just going to focus on the equipment here while I do this technique and walk you through it. So, okay, you've got your medication, you've got your alcohol wipe, you've selected your site for your injection, and you've got your needle and syringe. First thing to do, whatever dose of testosterone or estradiol that you're going to be pulling out of the vial, you need to put an equivalent amount of air in your syringe. This is to prevent messing up the vacuum inside of the vial. So let's just pretend like my dose is 1 milliliter. So I'm going to draw up 1 milliliter of air into my little syringe. Good deal. Set that to the side. Now, I've got my little alcohol wipe. I'm going to cleanse the top of this for 10 seconds in a circular fashion. Make sure that it's nice and sterile. We don't want to be putting bacteria into our estrogen or testosterone. Then I'm going to take that same alcohol wipe or a new one, whichever way you want to do it, and get a hold of the site and do the same thing, 10 seconds in a circular fashion to sterilize the site. Good deal. I'm going to set that to the side for a second here. Now then, make sure this is on a firm surface. Do not be holding it in your hand and accessing it like this. You will poke yourself eventually. So put it on a firm surface, okay? Okay. Now, take your top off of your needle. Hold it on a firm surface. You've got your air drawn up into your syringe. 90-degree angle, access the syringe into the vial. Then you can lift it up, flip it. You're going to inject the air into the vial, and then you're going to withdraw the amount of medication, which, like I said, I'm going to withdraw air because I don't want to mess up this vial of testosterone. But anyways, you withdraw the medication, however much it may be. We're pretending like mine is 1 milliliter. There we go. You can set your vial to the side now. Now, you've already cleansed your site, so you're ready and good to go with that. So, you will need to secure the skin, not tightly, but not loosely. Just kind of have a firm grip of one finger on each side, about 2 inches apart at least from where you're going to stick so that you're safe. And then you're going to go in at a 90-degree angle, 1 inch to 1.5 inches, depending on your size. And be honest with yourself. If you got thick thighs, stick it in a little bit deeper. Anyways, so you got your skin secured. You go in at a 90-degree angle, boop, like that. Okay, so what do you do with your hands? You're going to release the site now. You've already stuck. You're good to go. You're going to take this hand and you're going to actually hold the bottom of the syringe so that this hand is then freed up and can move up here and slowly inject the medication. Some people advise, even when you're done injecting, to leave it in place for just a few seconds before withdrawing to make sure that the medication is good and squirted out down there. Then you can grasp, let go, pull out. Ta-da! I would then grab my little alcohol pad, apply pressure, and just hold it there for, a good 30 seconds or so, and then put a little Band-Aid on it and get about your business. If you need to dispose of your needle, You can either purchase an official Biohazard Sharps container for yourself, or you can use a milk jug or a 2-liter bottle of Coke, something like that. But do please put a label on it that kind of denotes what you're using it for, and you know, just be safe. Anyways, so I'm going to walk back through that process one more time, just kind of quickly, so that you can see me do it without any commentary. Here we go. We got all of our stuff again. So now, pulling up the air, cleansing the top, 10 seconds. Cleansing the site, 10 seconds. Set that to the side. Top off the needle. Secure on a firm surface, 90-degree angle. Access the vial. Flip it up. Inject the air. Withdraw your medication. Withdraw the needle. Put your vial to the side. Grasp your site, 2 fingers at least, 90-degree angle, in by 1 inch to 1.5 inches. Grasp the bottom of the needle with this hand, move up, inject. Withdraw. All right. Now, hopefully y'all all learned something there. There's tons of tips and tricks. Everybody's going to find their own way of doing things. Not everybody is going to do it the same. It doesn't mean that you're wrong exactly. It just means you have a different technique. There are some wrong ways to do things. I mean, don't put it in your eye or anything like that. But anyways, if you have questions, you can always write to me. You know, I'm always here for y'all. If you need something, just holler, okay? All right, I'm going to go run and do the subcutaneous video now. Yay!